Hi, and welcome to this edition of A Conversation With, and joining me today for a repeat visit, Cheryl Bartlett. She is the CEO of the Greater New Bedford Community Health Center. Back for another go around here. Thanks for coming in today.
Oh, thanks for inviting me.
It has been it's been a few months since you've been in, but it's certainly been difficult and challenging to say the least. From your perspective, where do we stand right now with regards to the virus?
Well, first I want to say we're approaching rapidly a one-year anniversary of managing a pandemic, which is a really big challenge. I think, first of all, there's a lot of what I'd call public health fatigue in trying to keep up all the precautions that we need to. So I'll remind people, as hard as that is and as tired as we are, we need to keep up wearing our masks, socially distancing, minimizing the contacts that you have outside of your immediate household. So we'll start there.
I was going to say, it must be, from your perspective, I know we've talked to Damone Chaplin, the city's health director, and other people, probably at least half your battle right now is what you just said, the fatigue.
Yes.
It's because we've never experienced this before, and you do have it. It's in some ways, it's more mental than even the physical aspect of it.
Absolutely. It's just, public health, we've seen this before. We saw it with HIV and AIDS, where people just get tired of that constant sort of negative messaging in some ways to tell us what we can't do. But it's really critical, and I think we see that very clearly after the holidays, right, where we had a huge second surge. The surge began in the fall, second surge after our winter and early spring surge, and then it kind of calmed down in the summer when we could be outdoors and air's flowing a little more freely and we're less at risk. But then we went back indoors, we started to see the cases climb. People did not adhere the advice of public health experts over Thanksgiving and Christmas, and the numbers just went out of control. And now we're seeing 2 to 3 weeks after New Year's, where we're beyond the quarantine and isolation period, where the cases are dropping down, hospitalizations are slowing, and so clearly the social distancing and masking are critical to helping keep this under control.
The health center serves so many people. How have you, as an organization, been able to maintain and to keep going? Because I know, obviously, you've got to take precautions for your staff and what have you, but how would you say that the organization's been doing so far?
Well, first I need to give a shout out to everybody that works there, because they have done phenomenal work despite being fatigued and coming in day by day, short-staffed with people, our own staff being out on quarantine and isolation. So doing different jobs, we've had to reconfigure where we work and how we work so people aren't used to the workflows, the physical space. Half-time people are at home telehealth, but then that means the providers, physicians, and nurse practitioners don't have the support staff there with them, so they're registering patients and seeing the patients as a medical provider and then doing the follow-up. So life has been just turned upside down, and so I really admire their day-to-day perseverance and doing, following our mission and our vision and taking care of patients. So very hard to do. Our patients, first we pretty much closed down for a couple weeks, lost $1 million, which was scary from a business point of view.
Right.
Been around for 40-something years. I don't want to be the person this health center goes out on my watch.
Right.
So very worried about business, at the same time worried about protecting the staffs and the patients afraid to come in.
I don't think people realize either, pandemic aside, before this, you were one of the busiest health centers in the state.
Absolutely. We serve about 25,000 patients, about 25% of the city's population, mostly a lot of ethnic diversity that comes to our health center, and so we have to have people that speak all the different languages, and so we are a busy health center, and we have people that have a lot of chronic conditions, so we want them to get their health taken care of, but first our message was don't come in before calling us, because we
Right.
didn't want to have our employees exposed. We didn't want to expose patients. So only if you were sick did we recommend you come. We moved to almost 100% telehealth within 2 weeks, something we had no skills at doing. So again, a lot of stressors on the staff to
Right.
learn new technology. Our patients, who many of them don't have the capacity to have technology available to them, so we had to figure out ways to get in touch with them and help them during this time period.
I was going to say too, I mean, not just the healthcare folks in the hospital, in the center, but the administrative staff. You have to have so many people helping with those people with, for lack of a better word, the paperwork, or at least the online stuff.
Exactly.
And that has been probably as much of a task, if not more, than just the healthcare aspect of it, trying to
Right.
keep track of things.
Exactly, and when we moved to telehealth, we didn't, in Massachusetts, have a way to bill for it. And so insurers don't pay for telehealth in Massachusetts, and so the governor had to pass an emergency order that said they had to pay for it. At first, they paid us probably a tenth of what we normally would get for a rate. So again, I lost $1 million, and then I could see the dollars every day just dwindling because they weren't paying me at the same rate, but all of my costs were the same, plus some, because I needed protective equipment, I needed to change operations, I needed to have different kinds of cleaning processes in place, so costs going up, money going down. Eventually, the governor did pass a law that they had to pay us at the same rate as if we were seeing them in person. So that certainly started to shore us up from a business perspective, which was helpful to have a few less sleepless nights as we managed. And I think what was hardest is every single day, this was something nobody really knew how to manage. And so every week
And you've been a healthcare professional for a while. You've been
Yes,
at the
I
highest.
have.
You've been at the the highest forms of government too. Is it frustrating from that standpoint? Like, wait, this is just so new that we're all learning.
Yeah. For me, actually, I hate to say that I like these kinds of things. I like solving problems and puzzles, and for me, it's about getting as much information as you can and keeping that flowing in both directions to the staff, bringing it in, trying to synthesize it for them and share it. So we created a COVID communication corner where every day we put out new information about what we were learning, so we could all kind of start rowing in the same direction and figure out our strategies. We created fortunately, my chief medical officer is an infectious disease specialist, and we started planning in January. So we were fortunate that we were kind of seeing this come on our horizon and began to get ready. So we created what we call in healthcare incident command
Right.
and emergency preparedness, so that we could start taking in this information. And we met 3 times a day. So in addition to the work we did with the patients, we met before work, we met after work, we met on weekends, so that we were constantly moving the chess pieces around, so to speak, to increase distancing, to increase the ways that we could serve our patients given all of the complexities. So it was a nonstop 7 days a week thinking about this. Then going home and watching the news,
Yeah.
which sent me over the edge after a while. I realized, okay, don't put the news on. I'm living this and breathing this every day.
One of the things you've been testing for a long time, and as a matter of fact, some viewers might also recognize, if they didn't see your first show when you were here in the studio, we did a show, I even forget when, but we went to the testing center. You
That's
developed
right.
a site
That's right.
outside to show how, I don't want to say easy, but how really simple it was to get the test, how it wasn't time consuming or whatever. So, but that has been up and running, well, before we got there, because I know we
Yeah.
waited a couple weeks for you to get the kinks out, but you've done a lot of tests.
Yes, we have. We have tested maybe over 11,000 people. We've run probably the same positivity rate that the rest of the city is running, sometimes a little higher, because we have a lot of the vulnerable populations that come in for testing, and so the Spanish-speaking population, the African-American population, they have a higher per capita positivity rate, and a lot of them get services there. So we've been testing away. We became a test site for the state of Massachusetts for asymptomatic testing. that I will have to say, unfortunately, we are going to stop doing that on Friday as we switch to vaccinations. We really couldn't staff a whole nother area. We've had staffing has been a big challenge. We lost some people who, for personal reasons or health reasons, and themselves or their families, stopped working at the health center. And this is in a time when it's easy to hire people to come into a place that's a high-risk environment. And so our staff have been just really doubling up on their task. And so we had to sort of weigh what was the most important thing. And for me, vaccination right now, because if we vaccinate enough people, we will have less demand for testing. And so that's really where a big priority is right now, to not only vaccinate, but to educate people about the importance of vaccination. A lot of studies across the country are showing that about a third of people are very hesitant or absolutely have decided they're not going to get a vaccine. And if we don't reach 75% to 80% of people vaccinated, we'll never get to herd immunity that we need to start to relax some of these precautions that we're living with every day.
We're talking to Cheryl Bartlett. She's the CEO of the Greater New Bedford Community Health Center. One of the things that's been impressive that I've seen just behind the scenes is the communication, at least between three organizations that I see, well, four if you count the city. You got the city, you got Hawthorne Medical, you got you've got the South Coast Health. The four of you at least, and I'm sure there are others, but have been really communicating throughout this whole pandemic, and that that helps the city and it helps the region, really. Just get information out and the like. Absolutely.
I'll give a lot of kudos to the mayor for doing that. He very quickly created a COVID task force, and we came together. We came together every single day for probably about 6 months. When the summer season started to ease up on the number of cases and the stress level, we went to twice a week, but we meet twice a week to all just share what's going on in our little worlds about COVID. And then we can identify gaps and try to address them together. So that's been, I think, really a remarkable way to address a public health epidemic. And I don't know that all communities have that level of coordination and cooperation. And so not only those calls, but I was counting up in my head as I was driving to work today how many 1-hour calls I have in a week to talk about COVID and how to manage it. We got into having a weekly call about testing several months back, or probably 6 months now. I can't even keep track of some of this. And then most recently we started 2 calls a week to talk about vaccination ramp up. And so I would say I easily spend about 12 hours a week just talking about all the different areas we have to think about to manage this effectively. But good leadership in the city, I think, has definitely allowed us to stay on top of this together.
And so the overlap, there is overlap obviously, but it also helps fill gaps that were or might have been there if you didn't make those calls.
Absolutely. And over time, we built what the topics were that would be on our agenda. We have a standing agenda, but all of a sudden, right, vaccines come into play. So that's a new subject. So we bring new players in. The school is an important partner in getting the public vaccinated and education. And so they now participate in our calls so that we can stay on top of the flu vaccine rate, because that's been a recommendation that people get their flu vaccine, because if you get sick with the flu, then you're more at risk and susceptible to coronavirus. And so every week or so, a new item comes up that we have to really stay on top of. So we add that to the standing agenda. We invite new people. We then break out into subgroups to figure out the actual implementation strategies of some of these areas to focus on.
Let's talk vaccine here, because I think that's a big thing right now with the vaccines coming out, and people are starting to get their shots. But as you mentioned, 33% of the folks are reluctant to take it. And I know we were talking today on our meeting that we had today, department head meeting. The mayor was saying we've got to really promote that this is important. So how do I, or somebody who's not a medical expert, how do we say why is it important to get the vaccine? Why should they trust it?
Well, I would say, first of all, we want to reduce the number of people that get coronavirus and particularly try to protect the vulnerable populations that have a high risk for mortality from this. So I think it's stopping the number of deaths that we have, stopping the morbidity and mortality of this. And then if we as a community get enough of us vaccinated, the reason we don't have other public health issues like measles, mumps, polio is that we vaccinated enough people that these viruses can't live if they don't have a host that's susceptible to get infected. And so we can stop these viruses in their tracks if enough of us are vaccinated. And so vaccinations began in the United States the week of December 20th. I know we're up to about 1,000 people that we've vaccinated, but it's disappointing to see some of the hesitancy. Our staff, only about 50% so far have been vaccinated, and we got enough for everyone to get vaccinated. And I think the way that we can help is that we all have a sphere of influence in our lives, people that listen to us or look to us for being a role model, that we need to talk to them about that. We need to show ourselves getting vaccinated. We started a newsletter at the health center, and we put all different levels of the organization pictures of us getting vaccinated and putting out a statement of why each one of us got vaccinated. Some were because they were worried about their parents, their grandparents, their children. They want their kids to get back to school. I myself want to get back to seeing my friends and my loved ones. So I think we all have a reason that we can share with those around us who are hesitant, and you just don't know who you're going to be able to change their mind.
Is there concern, or concern might not be the right word, but I'm curious to, some people say, well, what about the Moderna or what about the Pfizer? I mean, do you have a concern, or if people say, I want this one and not that one, or should people just take a vaccine, because obviously it's been approved, but should they take what they're offered, let's put it that way?
Well, we only have the choice of what we're offered. The feds are distributing to the state, so whatever the state gets, it then redistributes out to the different providers that are giving vaccine. Pfizer can only go to places that have storage capacity for minus 70 degrees Fahrenheit, so that's a pretty cold storage, and we don't have something like that. To get that refrigeration, I think it's like $30,000 to get a freezer that I'd store it in. So the state is trying to figure out who can use Pfizer versus who can use Moderna. Pfizer also comes in 1,000 doses at a time, almost 975, and Moderna comes 100. Moderna can just be in a regular freezer. Some of the newer vaccines that are in the pipeline can be in the refrigerator. So a lot of it's on the capacity of the organization, and a lot of it's on the supply that comes into the state. We're getting, I think last week we might have hit over 100,000 doses, but prior to that we were getting about 70 to 80,000 doses a week. So trying to get those distributed to the right place and people and the capacity has been a challenge. So I know a lot of people criticize the governor for what's going on, but I wouldn't want to be in his shoes trying to figure out how to move all this around in a way that gets the maximum impact.
Well, you've got too the reading in the paper and what have you. You've got it's not an argument, the debate about whether you just get one shot, and then if the state or whatever entity is giving the shots, emptying the shots out, and then waiting for the second batch to get the second dose.
Right.
Or do you save enough of the shots so that the people who get the first shot get the second shots?
We've been giving them out because we've been told, and we've been told repeatedly, that the second doses are being saved at the federal level for everyone that's been distributed out locally. So we haven't run into an issue yet. We're doing Moderna. And it keeps coming. So I think a lot, again, that's up to the state to look, because everyone that gets a vaccine gets registered in a state system, the Massachusetts Immunization Information System, MIIS, and they keep track of every single dose that's gone out, which manufacturer, because we're recommending you get the same dose from the same manufacturer second time around. Pfizer's in 3 weeks, Moderna's in 4 weeks. They are talking about only giving one dose out so more people will get vaccinated, and that would get more people a level of protection, but not the highest level.
Correct, yeah.
So it's 95% of Pfizer if you get 2 doses, 94% for Moderna. But if you only get 1 dose, they say maybe around 50 or 60% level of protection. So I don't know. I want to be as protected as possible, so I'm a big fan of getting the 2 doses right now, and I did have my 2nd dose, so I couldn't tell you that it really actually also is a mental relief, and I've had people tell me that. Someone called me as I was driving here to say, it's changed my whole mental status just having that first dose
But
yesterday.
you recommend too, when we were talking off camera, you recommend if you're offered the shot,
Take
you
it.
should get it.
That's like
You know,
hitting
either
the
one.
lottery.
Either
Yes,
one.
Either one. They both, Moderna and Pfizer, work exactly the same way, so there really isn't a heck of a lot of difference, maybe a 1% efficacy for Pfizer over Moderna. They're looking at this Johnson & Johnson. I was just reading about that this morning. They're going in for approval at a 66% efficacy rate, and they're saying that vaccines typically, if they work at 50%, they're approved for use. So sometimes the flu vaccine is only about a 50%.
I was going to say, we've talked in the past about the flu shot, and the ironic thing about the flu shot is you just never know what strain of flu you're going to get any given year.
Right.
And then if you can get to, I guess, like you just said, the 50% is sort of the magic number. If you can
Right.
get to that, that's very helpful from a public health standpoint.
Correct. So
Because even if you get the flu, it hopefully lessens
it's
the
diminished.
impact.
Correct. So that's what they say about this, that it's a very protective in terms of severity of illness if you get vaccinated. So it's very complicated, but all I can say is that get vaccinated. It's really important for all of us, and I know that obviously a lot of people didn't follow the public health guidance over the holidays, and we saw what happened from that. And if we ever hope to go back to seeing our loved ones in the way that we did in the past, we need to do this together.
The other thing that you mentioned too is even after you get the shots, you
Right.
still, right now, we still have to take the precautions that we've been taking.
Absolutely, yep. Wearing a mask every day. I think in your own personal household, you can take a little bit more freedom. They say that, it's very important for us to keep the precautions up. We're probably safer than the population that hasn't been vaccinated, but you can't have 2 sets of precautions going on. We can't all of a sudden tell the vaccinated people, we don't know who's been vaccinated, unless we all get a big sign to wear. So that if people start to see people without masks and not following the rules, human nature is we want to be together with other people, that we will all start letting our guard down. So our guard has to remain up until we really reach the level of community vaccination we need.
And I know we talked about this a couple of times, but those safeguards do work. And
They
I know
do.
there are still people that are still debating it, but they do work.
Yeah, absolutely. We see that. I think we talked before the show that the flu, right? We wore masks this year because of coronavirus. We hardly saw flu. So I think that's just a real in-your-face example of that these precautions do help us. And so they're really very important. And in talking to my medical staff the other day, again, our infectious disease chief medical officer, Dr. Naz, that what they don't know yet, we still are learning about this vaccine and this virus, right, is that it's really, we've only been vaccinating now for a few months. About 30,000 people have been in the studies for Moderna and Pfizer. And I think I read this morning 45,000 people were in the Johnson & Johnson study, but we don't know how long the protection lasts because people haven't had it long enough to know how long it will last. Maybe it'll be like the flu and we have to get it every year. Maybe it'll be like other vaccines that we get sort of once and we're done with it. So, and then there is some lack of information about if you have the vaccine and you're protecting yourself, can you still be a carrier? Can you have
That's what I was going to ask.
virus in your nose and in your mucous membranes and still transmit it to someone who hasn't been vaccinated? So again, all those protections are really critical till we learn more about how this vaccine works and how does the virus survive in the face of vaccination.
And the people who've had COVID, they still should get the vaccine,
Yes.
correct?
Right, because we don't know how long the natural immunity
Okay.
is conferred to people. So yes, we're suggesting people get it. Now there has been some, for those who are sort of the naysayers, there's some probably misinformation that people got the vaccine and they got COVID. I haven't heard of that yet, but I have heard of that the day someone got a vaccine, later that day they were symptomatic and they tested positive. That was an exposure that happened before they got vaccinated. So the vaccine did not create this. This vaccine, in fact, does not have live virus or even weakened virus in it. It doesn't have any of the virus in the vaccine, so you can't get the virus from these vaccines.
I know you can't be specific, but I'm hoping that with the people that might be watching right now that are sitting there, they want to get the vaccine, and obviously I know that there's criteria, but what advice would you give people who are looking to get the vaccine right now? Just anyone who's watching right now.
First, I would say take 10 deep breaths and try to stay calm, because again, the news, I think, gets us all worked up about how people can't get things that they want, and they didn't have access to this just a month ago. So stay as calm as you were before vaccine was available, and stay informed by the news. The Mass Department of Public Health has a great website. Go online and read through that. It tells you where the vaccine sites are. It definitely keeps updating what information is available out there. Until we have the vaccine, people shouldn't be clamoring down the doors of places that are trying to vaccinate. We're getting doses like 200 in a week or 200 every other week.
Trickle's the word that I've heard
Trickle.
to describe
That's a great description. So here and there we get it. We don't know, and we don't know week to week. We were told last week that expect a few weeks with no distribution. And so there isn't enough vaccine for everyone to get vaccinated. So I think they should just check in and try to read the information that's out there and get guidance. I'm hopeful that we'll start to reach out to our patients and give some education and instructions to them. So we're just moving into the phase 2, which is the 75 and older, and then 65 and people with comorbidities, and then people, I think, in the education system maybe in phase 2 towards the end of it. But particularly if you're not in one of the high-risk categories, I've had 30-year-olds calling me up saying, hey, can you get me in there? It's like, no, you're at the back of the bus, I'm afraid to say. We need to get the most vulnerable people, the people that work every day in high-risk settings.
We'll go into more detail down the road, but I'm curious from this experience, do you think that there'll be changes in the way healthcare is administered because of this, or plans or what have you?
Well, I think telehealth is here to stay, so that's a silver lining that we've had, and I think people that have experienced telehealth, particularly if it's for some minor health-related question or concern, easy to hop on a video or a phone and talk to somebody, and so that's a really great change in the system. I think there will, I don't know about more working at home. We've tried people working at home, and it's easy to think that administrators from healthcare can be at home, but we're all part of a system that if it doesn't work together, it doesn't work for everyone. And a lot of the load ends up on the nursing staff who tries to do everybody's job that isn't there and capable of being there. And so we've brought about 50% of our folks back. Everybody's back about 50% of the time for providers, and more the people that were administrators are back, because the burden falls on the frontline caregivers, and that's not fair to them.
Anybody who has questions or wants to get in touch with the health center, what's the contact info? How can they ask questions?
Oh my God, you're going to ask me I don't have it off the top of my head. It's in my phone.
I will get it.
I'm sorry.
We'll put it up at the end, though. It's good seeing you again.
You too. Thank you for doing
Thanks for
this.
keeping us updated, and I'm sure we'll talk down the road not that far from now. So thanks very much.
Absolutely. Stay healthy.
Thank you. That's going to do it for this edition of A Conversation With. I'm Jim Marshall, the New Bedford Cable Network. Thanks for watching, and we'll talk to you again soon.